It's Notes from No More Hygiene. Good day, Dr. Nabors.
Oh, good afternoon.
So it is clear that COVID is here to stay. I don't think there's any question about the direction things are headed. I think 2 years ago, when COVID first broke, if somebody would have told us that 2 years later, we'd still be wrestling with the ups and downs of all this, I think, especially right now with what we're calling COVID cancellations and patients calling with, the next version of this, is just going to keep mutating into different forms. So we're dealing with this for a long time, and we've touched on this briefly before, but I think now is a great time to really dig into the fact that there is a connection between COVID and periodontal disease, not causal necessarily, but preventative. So talk to us about the connection.
Right. Well, it's a cumulative effect. And I think that's what we often miss in terms of this sort of oral systemic component. So many times, and whether it's in dental literature or just in conversation, we want to associate gum disease or periodontal disease with a teeth problem. And we all know that. But science outside of the dental community is tying periodontal disease to all the systemic diseases that we talk about a lot. And this latest one is, the correlation between the severity of COVID-19. Not just that it doesn't cause COVID-19, but what they're saying is that patients with alveolar bone loss are more likely to experience severe COVID-19 than patients with normal amounts of bone. So they're saying in this, which is in Perio Implant Advisory, that patients with alveolar bone loss are almost 6 times more likely to be admitted into the intensive care unit than patients with normal amounts of bone. And for every tooth that was lost, a patient had a 4.2% higher odds of experiencing severe COVID-19. So it's basically takes what you already are experiencing, and then because of the additive effect of periodontal disease on the overall health, it's allowing the COVID-19 to become a lot more serious.
So is that so the bone loss is the indicator, but are they really saying that you have bone loss, which means you have periodontal disease? Is that what they're really saying, or am I taking?
They're saying that your periodontal disease condition, to the point that it has affected the alveolar bone. We say this, you've got an infection in your head, it's causing the bone of your skull to dissolve. We kind of joke and we say we should call this head rot or skull loss, but we kind of minimize it by calling it bone loss. Like that's a normal thing, or a little bleeding, or you've got some 4mm pockets, or maybe a few 5s. Like that's okay. Like any amount of bone loss should not be something that we're flippant about. But what they're saying is that that COVID-19 has been discussed with periodontal disease, but they're now honing in on it creates a possibility of a bacterial superinfection. Bacteria found in patients with alveolar bone loss can lead to viral superinfections that increase the severity of COVID-19. Heightened inflammation, and we talk about what inflammation does to the body. Then they go on to say poor nutrition and other risk factors. I'm kind of looking at it here, but the whole study is really highlighting the significance of the mouth-body connection. And the research articles that are in this, one comes from Advances in Oral and Maxillofacial Surgery, about the Journal of Biomedical Engineering, Medical Hypothesis, Journal of Nutritional Health. I mean, these aren't fringe articles. I mean, they're articles from surgeons and surgical studies about what COVID-19 is doing to our body, and then how periodontal disease being in that person is making the results of COVID-19 more severe.
Healthy mouth, healthy body.
Correct.
So bottom line is, if you have a healthy mouth, then at least the research is now indicating that the severity of COVID-19 could be much less. Did I get that right?
Absolutely.
Right. Stronger immune system, able to protect your body, the whole deal. So I found this relevant, especially in potential conversation with patients. It's on everybody's mind. Yes, we've got great, the vaccines come out, which is awesome. The vaccine doesn't necessarily mean you won't get it. At least what they're saying is it should lessen the symptoms. Well, basically what we're saying is the same thing here.
100%. Yes.
A healthy mouth, then the symptoms should be much less, and you should have a better chance of if you do get it, you'll have a better chance of getting through it without as much disruption or potential hospitalization. Did I get all that right?
Yes.
Very good. So we'll include the link with this video, link to the research. Again, great to share with your team, great to share with your patients. Just one more reason to have a great periodontal therapy program, like modular periodontal therapy, like we teach in No More Hygiene, because it is all the science continues to point back to the fact that, man, if you got a healthy mouth, you have a much better chance of circumventing and avoiding systemic diseases, and now COVID-19.
Yes,
Very
sir.
good. Thank you, Dr. Nabors. Upcoming No More Hygiene. You can go to nomorehygiene.com for all of the details, and look forward to seeing you all there.